One of the limitations, however, of the original thermocouple device is that it was only able to record differences from left to right in temperature. Now here are two graphs of a cervical spine, and you would say, looking at these two graphs, that they were very, very similar. In chiropractic terms, this patient would be considered in pattern if indeed that darker line represented their pattern of interference, and we'll talk a little bit more about that later. The problem with the thermocouple device is that sometimes a patient can present where that middle graph, the difference from left to right, appears to be very similar to their pattern, but when looking at the actual skin temperature on the second reading, this would be the actual temperature of the skin on the left and the actual temperature of the skin on the right, which the thermocouple is not capable of reading. You'll see that it was a totally different set of temperatures on that body that led to this center graph. Reports back that we get from doctors who have used thermocouples for a considerable amount of time and then have started using the C3000, which does read actual skin temperature as well as displaying difference, report that they would estimate about 20% of the times that they adjusted patients, the patient probably was not technically in pattern and did not need to be adjusted. And in fact, in those cases, the adjustment may have even hindered the speed at which that patient would recover. Our device uses an infrared sensor. Normally, these sensors have a window aperture or an area of sensitivity of about a cone of 60 degrees. If an instrument is constructed without a lens and without a focusing barrel, the area of skin that is being averaged or read depends on the distance from the sensor. If you're up close, you're looking at a smaller area than if you are further away. When scanning the spine, of course, we have to deal with the spinuses and the shape of the back, so it's not always practical to have the sensor right up against the skin. Because of that, in the C3000, we developed a culminating barrel and placed a lens in front of our sensor, allowing only parallel rays to enter this system and be recorded. Therefore, we maintain a constant field of view when scanning the person's back. We chose this area to be very similar to the area covered by the thermocouple wires in Dr. Evans's original scanner. To show you the three graphs generated by scanning a person with a C3000, again, we actually read skin temperature on the left side of the spine, the right side of the spine, and of course the difference which you're used to from the old original instruments. The added feature is that when we see a temperature swing to the right, as we do here, we can tell that that was caused by a acute hot area on the right side of the spine and not necessarily a very cold area on the left. In this case, what appears to be a cold swing to the left would indeed have been caused by a warmer area again on the right. These hot areas would be very indicative of soft tissue or recent injury versus chronic cold as in this area. So some forensic diagnosis of when an injury occurred is possible with thermography. Well, what do we expect as normal readings? What is normal? In the late 80s, Johns Hopkins did some research. A Japanese doctor, using an infrared camera, took 100 patients and followed them for a year. They were half females, half males. They ranged from 17 to 70 years in age. The one thing they had in common is that they were all extremely healthy. Perfect blood chemistry, never in a car accident. very, very rarely ill. These were superhuman beings. The camera images were divided digitally, electronically in a computer, into 80 areas of interest. On the back, you can see that along the spine, paraspinally, we were broken into the cervical area, the lumbar area, the sacral area, and tabulations were made of that data. Over the cervical spine, the average temperature difference from left to right seen on those dermatomes was 0.23 degrees centigrade with a standard deviation of less than 0.2. In the main trunk, the thoracic area, 0.2 degrees. In the lumbar area, 0.28 to 0.26. What we're seeing here is that for a normative database, very, very small temperature deviations in the patients presenting paraspinally. There's been many studies done comparing temperatures on the body and their difference from left to right with individuals with various diseases. What we have found in looking through the research, and there's like 9,000 peer-reviewed papers now on thermography and its relationship to nervous system function, that any temperature deviation beyond 0.8 degrees centigrade anywhere on the body, from hand to hand, thumb to thumb, toe to toe, correlates 96% with some pathology in the body. This is very important for you to know as a chiropractor. Now, I mentioned we would be talking about pattern, pathological pattern. I like to use the example of a piece of popcorn caught in someone's teeth to explain to patients why we get these temperature readings. Everyone has had something caught in their teeth. And you know that that sensation does not cease until that object, that piece of popcorn, whatever, is removed. The mechanoceptive nerves surrounding those teeth in our jaw know neurologically where those teeth belong, where the body's used to seeing them. When that popcorn dispositioned 2 teeth or more, the nerves and the sensory nerves in that area tracked to the spinal cord and tracked up to the brain to a pain center, and we knew that something was wrong. When you look at, just for a moment here, I'm going to put up a sample set of the Axis and Atlas. For a long time, and give them the benefit of the doubt. 100 years ago, we didn't have MRIs. We didn't have the research capabilities we do today, nuclear isotopes being used to track function in the body and nerve pathways. It was thought in the past that a direct biomechanical insult to the foramen holding the spinal cord was actually putting pressure on the cord and thereby causing the results that we see chiropractically and also the results on the graphs. Not that it's impossible for that to happen. Things like discs having a problem or tumors can indeed put mechanical pressure on the spinal cord. More than likely, however, what we're seeing is, in the case of the popcorn in our teeth, a slight disposition between 2 vertebrae. The sensory nerves in the area are stimulated. They work into the spinal cord at that level, into the lateral cell horn. They stimulate the sympathetic nervous system, which then comes back around and causes vasoconstriction in the blood vessels, not only in the skin,